Nigerians are among the world's most prolific medical tourists, as over tens of thousands of Nigerians troop abroad every year in search of the best and affordable medical treatment and healthcare services, expending over $1 billion every year. Experts at the medical conference, however, are calling on the federal government for a change in strategy and the right policy to reverse the situation.
The size of the global economy for medical tourism is $438 billion. And there's 11 million travelers on tourist travelers, medical tourist travelers. For Nigeria, what we spend is estimated at $1 billion, but it's still a poor estimate. Anyway, and about 10,000 people go in and out. The case is that if there's an industry, if there's money to be made in the industry, we should have a national strategy for medical tourism.
What we have already seen in National Hospital, for instance, is that people are returning from India, from other places, because it's much cheaper to do it at the National Hospital. You know, for instance, radiotherapy that used to cost Nigerians about $10,000 if they travel to India, it costs less than $2,000 at the National Hospital.
For Nigeria to see a drastic change and turnaround in its medical sector, there is need for public-private partnership in developing the needed infrastructure for the growth of the sector, and the government must create the enabling environment for the sector to thrive.
The main problem here is that everybody looks up to the government for everything, and the government doesn't have everything. The best countries in the world, when it comes to health, they don't depend on the government. The government only lays the foundation and only creates the enabling environment. You know, like in agriculture, the government has given very low interest rate loans for development of agriculture. So the most the government can do for health sector is create the environment.
The state of our health care, it has to be led by private sector. And there are specialist private sectors like Helena that can actually pull the traffic. Both traffic of people who would have gone abroad to do this and people who would come in to do this here. And these are because there are cost-sensitive medical tourism, and there are two major. One is on the quality and one is on price.
It's going to be on a PPP basis. You cannot think on a public institution that will maintain this kind of thing. It's going to be very difficult. But I do hope that government will also try and strive to ensure that our infrastructure is stable. Stable, regular light supply, regular water supply, and therefore we can obviously start to improve the kind of our facilities and the Medicare that we offer to our citizens.
With the active involvement of the private sector, Nigerians can now access affordable and standard medical treatment in the country. The Nigerian government has also been urged to tackle the issue of doctors' emigration urgently by providing adequate welfare for medical practitioners to curb the excessive exit of doctors from the country. Helena, Olori, reporting for